Hey everybody, my name is drdinopappas. It's been a minute since I've made some videos that were non-podcast videos for the channel. I'd like to say thank you for those that have subscribed and shared the videos. My intent with this page is to provide some information that can help doctors, chiropractors, physical therapists, and also patients as well kind of sift through the tons of information and data that's now accessible in the area of healthcare. This video is going to be about the use of artificial intelligence by doctors and by patients and kind of where things kind of stand at this point in time. So first, let me rewind and tell a little bit of the story. I graduated chiropractic school in 2009 and opened up my own practice shortly thereafter. And I don't think in 2009 that many doctors, including myself, were equipped with the ability to handle well the following piece of information that patients provided us. Well, WebMD said blank, or well, I did a search on Google and it said blank. I feel doctors didn't know how to address that questions to patients because they weren't knowing what patients were really asking about. And they also, unfortunately, and even in my situation, we all kind of let ego get in the way. And what do I mean by that is we were not prepared to answer that question. We also assumed that they had a ton of unfiltered medical information available, but they didn't know how to connect the dots. And trying to connect the dots, they were using sources like WebMD and Google. And this unfiltered information was actually a threat. That's the perception by doctors to providing them with the best medical advice. And unfortunately, many, including myself, we all got it wrong. Really the message of the time, circa 2009, 2010, all the way up 2020 and 21 was patients cared about their health. They were seeking information so they could be prepared healthcare consumers and in fact, better patients. And their attempt to try to patch that gap was to go onto the internet and was to use sources like WebMD and use Google. And folks like myself were getting it wrong. We were missing the end of the forest through the trees, and that patients were actually caring enough to go out on their own to seek out this health information so they can be better patients, be better healthcare consumers, and they can also have an idea of what was going on behind the scenes. So my response switched over the years from the Googles and the WebMDs, from scoffing at first and taking it as, hey, you know what, you're just getting a bunch of bad information, to acknowledging it. Wow, I'm actually glad that you looked it up, and I'm actually glad that you are becoming an educated healthcare consumer, because now we can channel you and funnel you appropriately so that we can get a better healthcare experience and a better healthcare outcomes. Which brings us to today. I've seen in the past couple weeks more and more patients come into the office referencing using tools like Gemini, Copilot, and chatgpt, and coming in with a preconceived notion of what proper healthcare should be, what healthcare they should receive, what are the benefits and the risks, what are the alternative options, and what is the time frame. And I'm actually happy because, let's face it, if you're a healthcare provider, we're a couple generations away from the artificial intelligence and the chatGPTs of being able to out-diagnose, out-treat, out-manage, out-image, out-interpret us from a medical standpoint. So patients are really looking for, in the future, a very personalized healthcare experience, meaning one-on-one time with a provider who can further funnel them into better decision-making and potentially better outcomes. So I'm going to flash back to years ago where I mentioned we all did not know how to answer these questions when the dawn of the internet, the WebMDs come of the world. Be prepared today to have solutions and answers when patients come to you with, well, ChatGPT came there. And my response is flip this into something very positive. I am grateful that you ended up searching out ChatGPT. It gives me a good starting point. It shows that you care about your healthcare. And in fact, as a team, I think the combination of you looking in that and me being able to make this very personalized for you will make a very positive healthcare experience and a very positive outcome. So guys, this is a long way of saying, let's use the patients being motivated. Let's use the patients looking at ChatGPT, Gemini, Copilot, all these other tools, in a very positive way to get them exactly what they need, a very positive outcome, a very time-efficient outcome, a very cost-effective outcome in a short period of time. I want to know what you guys have to say. I want to know what you guys have to think. If you're a patient, please comment with how you're using ChatGPT. If you're a healthcare provider, how have you refined your answer to patients? How have you refined your searches for information to better assist your patients in healthcare? I am Dr. Dinopappas, and thank you for watching. If you like this, please subscribe and please share appropriately. Thank you.